Well, the first rounds of the Pfizer coronavirus vaccine are expected to go out this weekend, but what will distribution look like here in Maryland? Joining us to talk about their plan is Maryland Deputy of Health Secretary Dr. Jinling Chang. Good morning. Thank you so much for joining us this morning.
Good morning. I'm so glad to be here.
Dr. Chang, go ahead and tell us what is going to happen. Where are these FedEx and UPS trucks going to roll up to?
So, when Maryland first became aware of how much our first initial allotments would be, we are directing those to go to nursing homes and hospitals first. Nursing homes will be allocated vaccine through a pharmacy partnership, but the hospitals will likely be among the first to get vaccine here in the state. And so those shipments will go directly to the hospitals.
And then the hospitals are ready with these refrigeration units. Is that right, to be able to take care of the vaccine?
Correct. Many hospitals have the refrigeration or freezer units necessary to maintain this vaccine at the -80. But also the shippers that the vaccine will come in should be able to maintain the vaccine at that low temperature with the dry ice that's packed in it for a period of time.
So once the hospitals get the vaccine, they're going to go ahead and start administering it to the first responders there in the hospital. Is that right?
Correct. So the vaccine will be to protect individuals who are the frontline healthcare workers within the hospitals. And over time, we will be able to allocate more and more doses to the hospitals so that they can ultimately cover all of their healthcare staff.
So how will people be notified? We had said something last week about how basically if you're in line to get a shot, you're going to know it.
So initially, the hospitals will work, of course, with the people that work there to identify them and arrange times for vaccination. They are all setting up their own small clinics within the hospital and on site. Over time, as we ramp up vaccination across the state and as all the states have more availability of vaccines, that individuals should be able to get vaccines through their local health department or their providers. But right now, we are focusing our vaccination efforts within hospitals and nursing homes.
All right, and we ran a story yesterday about the UK warning about people with severe allergies having some sort of a reaction to this vaccine. So what type of allergies are we talking about here, and what are you advising?
So there has been, in the UK experience, a few people who had an anaphylactic reaction. And so yesterday, the CDC's Advisory Committee on Immunization Practices, or ACIP, really took a hard look at what that meant and what that might, what guidance they might provide for us. They are probably, and they will lean, I think that they will be issuing that guidance today. But what they were looking at was perhaps having a warning that individuals who've had any kind of anaphylactic or severe allergic reaction to any part of the vaccine previously, or who've had an allergic reaction to any injectable treatment in a prior, with prior experience, that they perhaps hold off on receiving the vaccine. But we'll have more information on that later.
So we've talked about the resources that you're going to need for the rollout of this vaccine, and especially with these first initial doses. Are you going to be keeping track of the people who've received at least the first dose of the vaccine to keep track of sort of the symptoms that they've been getting?
So absolutely, and not just the first doses, but it's important that everyone who receives the vaccine keep track of any reactions they may have, and report them. Many people who did receive the vaccine during the trials had pain at the site of injection. That's common in other vaccines as well. And a smaller number of people had more systemic effects. So they might have had a low-grade fever or a headache or tiredness and muscle aches as well. So people should expect that they might experience some side effects after receiving the dose of vaccine, maybe in the 1 to 2 days after.
I had an email question from a viewer wondering about transplant patients, if they're able to get a vaccine.
So they would be among the individuals who would be at high risk for complications from COVID. Again, as we have more vaccine in the days and weeks ahead, we'll be able to provide information for those individuals who are in that high risk category as to where they could get vaccine. We are dedicating our initial allotments to vaccine, and it's still very, very limited in quantity. And so we're putting those in hospitals and nursing homes to protect the people who are the most vulnerable. We've seen a lot of unfortunate concerns and issues coming out of nursing homes and people who are really affected. And we want to protect our frontline workers and the critical healthcare infrastructure we have.
And you've been saying that the general time frame for the public will be sometime this spring. And you had mentioned by that time, maybe a delivery system like going to your local health department or your doctor's office or provider. Surely not every doctor's office can afford these types of freezers necessary to store the vaccine.
Correct, and that's absolutely a challenge, but there are other vaccines that are coming down the pipeline as well that are a little bit easier to handle and don't need that ultra cold temperature. They might need regular freezer temperatures, and that's much more manageable.
All right, and before I let you go, basically, how excited are you about this?
You know, this is something that with everything that Maryland has been doing with testing and contact tracing and buying PPE, working with nursing homes, we knew that vaccine was coming. So this is a really important time for our state and for our country. But it still is, we want to let people know that it's still a limited vaccine allotment that we have, but we are going to work as hard as we can to get as much vaccine for Marylanders and get it out to the people who need it.
All right, and your time estimate for, let's say the vaccine arrives in Maryland tomorrow, how soon do you see the first person in Maryland being vaccinated?
So I know the hospitals that are getting it are working very hard to make sure that they are able to stand up their clinics. So it probably is sometime in the early part of the week.
All right, Dr. Chan, thank you so much for joining us. Really good information this morning. Appreciate it.
Thank you.